Hello, my name is Dr. Nina Fuller-Shavel, and I'd like to welcome you to my talk for the Power of Touch Integrative Cancer Care Conference. I'm going to share a few slides with you now. So I'm really here to talk to you about integrative oncology in practice. A bit of an introduction about me. I have degrees in natural sciences and medicine from the University of Cambridge. I also hold postgraduate degrees in nutrition, integrative medicine, and multiple additional qualifications in integrative health, including health coaching, herbal medicine, yoga, and mindfulness. I'm a fellow of the College of Medicine and Integrated Health and the co-chair of the British Society for Integrative Oncology. I'm also director of Synthesis Clinic in the UK. We're currently based in Hampshire, and we are an award-winning multidisciplinary integrative medicine practice specializing in women's health and integrative cancer support, mainly for solid tumors. I have presented multiple national and international conferences on women's health and integrative oncology, and I'm a research committee member and abstract reviewer for the European Congress of Integrative Medicine in 2021. I'm a member of the editorial board for the New Nutritional Medicine Journal and a participant in the Society for Integrative Oncology International Guideline Development. I'm also an educator as well as a clinician and a researcher, and I provide training for medical and nutrition professionals in integrative medicine for women's health and integrative oncology, having developed my own approach called Systems Approach to Cancer. So today we're going to be quickly reviewing what integrative oncology is and why it matters, and talking about Synthesis Clinic as an integrative cancer care clinic and how we apply this approach in practice, and a little bit about the Systems Approach to Cancer model. So integrative oncology, what is it? It's an integration of evidence-informed, conventional, psychological, nutritional, lifestyle, and complementary medicine in cancer care with the aim of supporting better quality of life, improving resilience, minimizing the side effects of treatment, and improving clinical outcomes. And in the UK, we have BSIO, which Dr. Penny Kehayoglu and I co-chair, and you might be able to find more interesting information on our website and join us there. Why should we bother doing integrative oncology? Well, patients or clients are already doing it. And based on different various sources in the scientific literature, we know that between 40 to 90% of cancer patients use complementary medicine, and the average is likely to be around about 50%. Most cancer patients who might be wanting to use complementary medicine are younger female. They tend to have higher education and have sometimes previously used complementary alternative medicine. It's important to realize that in the conventional medical practice, saying no to everything by an oncologist means hidden risk and internal conflict for the patient. And it doesn't actually mean that they're going to comply. So to me, safe integrative oncology means about being open and honest on both sides, with mutual respect, and ensuring that there are appropriately qualified and experienced practitioners on the case with people with an active cancer diagnosis, with ideally regular interprofessional communication. Knowledge is really important, and I know that you are sold on knowledge and education because you're here. But it's interesting to understand there's quite a big disparity in conventional medicine understanding of integrative oncology or integrative medicine approaches and their assessment of how much patients are using it versus what we might see in practice. So to recent abstract presented during the American Society of Clinical Oncology annual meeting, we can see that 73% of patients with breast cancer reported using at least one type of complementary medicine. But actually, their oncologists think that only 40%, so 43% were using these approaches during cancer care. So there's a disparity of 30% between what oncologists are thinking is going on and what is actually going on truly in clinical practice. So it's important to address that gap. It's important that oncologists are open and if they don't understand what the patients are doing, they're at least willing to listen. And it's also important that we do keep patients safe so that if we don't disclose certain things, they might interact with medications, and that might make cancer care less effective. So we do want to make sure there's good communication, openness on both fronts. Our own breast cancer clinic research has been presented at the international conference this September, so hot off the press. And we show that women who have been diagnosed with breast cancer found integrative cancer support very important in their overall care. So women who came to Synthesis Clinic to get their support rated their integrative breast cancer support as high quality or very high quality. And 100% of them felt that's been extremely or very important in their overall care plan. What's interesting is that 67% of women we surveyed felt that their conventional care teams had no working knowledge at all of integrative oncology approaches, which made things very difficult. And the most common aspects that were identified as lacking in conventional care within the NHS were nutrition and recurrence risk management advice, lifestyle advised, personalized care, and psychological and emotional well-being support, which is part of what we deliver at Synthesis. So what does integrative oncology have to offer overall? And I would suggest that it offers a sense of agency and empowerment for the person and their clinician, supporting resilience versus this learned helplessness. And many people after diagnosis just get told to, go home and we'll take care of it. There's nothing you can do about it. And this is simply not true. There's plenty that patients and clients can do to support themselves after diagnosis. And we need to be encouraging that instead of fostering learned helplessness. We'll take care of it all. Integrative oncology offers multiple modalities and an expanded toolkit to support cancer prevention, rehabilitation, that's preparation for treatment, for better treatment tolerance and recovery, better management of side effects of treatment, and opportunities for improving clinical outcomes in terms of synergizing with treatment, faster recovery following active treatment, better management of recurrence risk, and also opportunities for care of patients with metastatic disease, both in living well with cancer and at the end of life. I think it's important to understand what integrative oncology principles are or should be, because there's quite a lot of misunderstanding out there. It is a rational and personalized integration of the best in conventional psychological, lifestyle, complementary medicine. It is whole person oriented and addresses physical and mental, emotional, and spiritual needs of the person. It is supportive of targeted personalized medication use where necessary without over-medicalizing the person or their needs. It's about caring for people and not just providing mindless protocols. And it is evidence-based medicine. It is combining the best available research evidence, which sometimes we acknowledge might be a little bit on the ground in some areas. But it's also about incorporating clinical expertise and patient values in everything we do. What integrative oncology is not, it is not green pharmacy. So it is not just providing lists of supplements instead of medications, because without any personalization, without any checking of interaction, which is not safe, it is also not about disregarding conventional medicine. It's about making the best of every single approach in a way that is right for that person at that time. And we need to make sure that as patients' needs shift, care plans need to shift with them. Here is an example of an integrative oncology framework from a paper that was written by the Memorial Sloan Kettering Center, which practices integrative oncology in the US. And here they talk about the core of integrative oncology consultations about being lifestyle management. So talking about nutrition and diet, physical activity and exercise, sleep, and stress management and psycho-emotional well-being. And these are all very core approaches on which everything needs to land. So no matter what herbal medicine, what supplements you might use, they need to land on a strong, solid lifestyle framework. I always say you can't out-supplement bad lifestyle. And it is true, because actually anything else is icing on top, but you must have a strong core and strong foundation. If we are considering herbs and supplements, we need to assess and address expectations. We need to think about safety and potential herb-drug interactions. We need to think about what's appropriate for the right person. One supplement might not be appropriate for someone with chronic kidney disease or liver impairment due to their cancer treatment. It is really essential that this is personalized and done by a professional. And here are also some examples of integrative medicine for symptom control. So we're obviously aiming to go beyond symptom control in integrative oncology in cancer. We're aiming to support the whole person beyond that. But it is also useful to know few modalities that have good research evidence for being able to support people with specific side effects. So as you can see, for example, massage comes up as an evidence-based modality in helping pain, anxiety, and neuropathy, for example. Acupuncture come across the board in looking at pain, fatigue, for example, hot flashes, dry mouth, neuropathy, and nausea and vomiting. So there's a number of things that we can be using to support patients beyond the pharmaceutical management as well. There are key points of safety which I will highlight. And like with conventional treatment, like when we're talking about chemotherapy or surgery, we do need to assess the risk to the patient and the benefit on an individual basis. And we know that many complementary therapies are extremely safe when they're done by a qualified practitioner with the right qualification, insurance, and professional body registration, but are not self-administered without guidance. Of course, we can quite often teach patients and clients self-management techniques, but it is important, particularly within active cancer treatment or with complex medical backgrounds, that this is done by a practitioner first, and then a self-management plan is created. It is absolutely essential to interaction check supplements and herbal medicines with medications. It is not a reason not to use them, and I use them frequently in clinical practice, but it really needs to be done under professional personalized guidance, not using lifts off the internet or out of a book. However well it is written, it's really important that this is personalized, that quite often I would base my recommendations on the patient's overall well-being and what they're struggling with in symptoms, on what's going on with their cancer, what their cancer type is and where they're at with it, their current blood test results, as well as their current medications and treatment plan from oncology. So you can see that this is quite a complex area, and just chugging away tons of supplements without any personalization or any targeting is not helpful within the cancer setting. And the same applies for repurposed drugs. They need to be personalized, tailored, and the rationale behind them needs to be understood. But of course, we also need to know that, and this is something that BSIO is very much encouraging dialogue around, is that not offering integrative oncology input or not being open to discussions about it in conventional care actually is not useful at all on anybody's side, because it places more people at risk, because there might be all sorts of unregulated, poor quality information on the internet without any evidence base. Or there might be someone who's done a 2-hour coaching qualification, talking about their own personal experience of it or their own personal opinion on it. But this is not you. This is not the person in front of you. So it is important that we listen to people who have the right qualification, right clinical experience, who are actually working with cancer patients. If you're thinking about referring some of your patients, you can refer for broad support in integrative clinic if someone is interested in exploring integrative oncology in general, or if they might be struggling with specific symptoms, for example. And of course, also free charity support, which is brilliant. So Yes to Life being one of the key charities in Penny-Brown, UK as well. If you're making a referral, or if you're considering that you might want to send your client to somebody, it is important to check qualifications, professional standing, and experience in cancer support, and do look at reviews and, of course, website content to make sure that the expectations and the needs can be properly addressed. I'll tell you a little bit about Synthesis Clinic because that's what I've been invited to do. So as I mentioned, we're an award-winning women's health and integrative cancer care practice. We have medical doctors on board, we have a nutrition team, we have psychological and emotional well-being coaches, physiotherapy, physical activity, and we also refer out for a number of different modalities. And this is our current team, and we have new additions coming up as well. We have won 2 awards in the last 2 years of being open. So we are winning the Best in Women's Health Service in Hampshire and a recent Women's Health Service of the Year winner for South England. So in terms of our clinic team and the way that we work, we have a lead medical doctor who is me with our supporting team. We normally have patients or clients go through individualized assessment, quite often initially with a nutrition team member, or it might be me, depending on availability in clinic. And this would include clinical history. Of course, if you are in with a doctor, it might include an examination. I would be reviewing things like oncology imaging, test results, review of the oncology plan. We might be considering additional testing as appropriate. And we do quite extensive testing and assessment to personalize care as appropriate to the person and their budget as well. Within our team aims to produce a personalized plan based on the different aims and the stages and the patient needs and goals. Again, from the medical perspective, we can offer medication review, but of course, we always target lifestyle as a core, supporting nutrition in a personalized way, not generic guideline recommendations, physical activity, sleep, stress management, and additional targeted support that is checked for interaction and appropriate referrals to other therapists outside of the clinic as well, because we're aware of the fact that we can't cover all the modalities that our patients and clients need. So we love referring, and we love two-way communications when we do refer out of clinic. We have regular monitoring with symptom and quality of life scores, regular blood tests, whenever possible, either done through the NHS or through us. Because it is important. It's important to see that the impact of the interventions you're having is impacting the person, that they are coping better with treatment, they are more resilient. You know, maybe their inflammatory markers are falling, maybe they're doing better in other ways. So as I mentioned, I lead members of the team who include nutritional therapists, physiotherapy, rehabilitation, Pilates, and scar work we have in-house. We also have emotional well-being coaches, and we refer out for psychology or trauma therapy as appropriate to the person. We refer for specific therapies depending on needs, such as cancer exercise specialists, although we're building a team in-house as well. And for example, acupuncture during chemotherapy for nausea and vomiting and peripheral neuropathy. And the approach we use in clinic, which I will quickly introduce you to, is systems approach to cancer, which is a model I've created through looking at some of the systems biology, some of my functional and integrative medicine training, with a number of different leaders in the field, as well as my own thinking about it and what I see plays out every day in clinic. So this is one of the models sheets that we use. As you can see, it has a lifestyle review built into it. It has the person's timeline in terms of any factors that might have predisposed them to their diagnosis or might have triggered their diagnosis in any way. And we also look at the different physiological systems. So seeing the person as a whole and how they might interrelate. Because quite often patients are being told it's bad luck, or there's nothing you can do about things, or don't worry about your blood tests. It is important that we do assess things thoroughly and that we personalize treatment. So as one of the great people in the field, Dr. Aisha says, you know, test, assess, address, don't guess. It is important to do this properly, rather than just checking sheets and generic information and lists of supplements or lists of food advice at people. Both the personalized support for the whole person and the personalized support for the type of their cancer, what their cancer is doing, and what kind of treatment someone is receiving is absolutely essential. So we might want to look at healthy microbiome balance, so the different gut bacteria and fungi that we might have, and all sorts of other microorganisms, and look at supporting the gastrointestinal function. Gut health is really important and relevant in all cancers because it affects the way you absorb nutrients and utilize nutrients. It also affects your gut immune interactions because your gut health affects your immune health. And depending on the different cancer types, you might be looking at different microbiomes, not just the gastrointestinal or the stool test, for example, but looking maybe oral health or vaginal health. That's important for specific cancer types. We're looking at having balanced immune function and decreasing inflammation in our clients or patients, and supporting a balanced and specific anti-tumor response, which we can do with multiple different modalities. Effective detoxification is important. It does not mean, please, going any crazy detoxes during active cancer treatment where the patient might already be quite depleted, but it does mean reducing toxic load, reducing the exposures from something called the exposome, which is a totality of our interactions with our environment. So looking at air, food, cosmetics, all the additives within that, and home products, making these as less toxic as possible. And we've got resources from the environmental working group or think dirty apps, to be able to help us out with that. And we're aiming to promote normal, balanced detoxification processes as appropriate, looking at kidney and liver function, and other modalities, but without interfering with medication, which is really essential. Looking at supporting healthy circulation, tissue architecture. So cancer, for example, is quite a pro-clotting state. So actually normal blood flow is really, really important to be able to manage that risk. And we can do multiple things to try and support healthy blood clotting, not excessive. We might look at angiogenesis and metastasis, which is all about new blood vessel formation in cancer, and also cancer spread, for example. Look at mitochondrial metabolic health is important because we know that people with metabolic disturbances, that sweet tooth or pre-diabetes or diabetes, do have a higher risk of cancer. So that needs to be managed. We need to normalize insulin and various different growth factors that we might want to be assessing on a personalized basis, and look at human metabolism. For the hormone-dependent cancers, particularly like hormone-driven breast cancer, we might want to be thinking about how the different sex hormones are produced, transported, what kind of receptors, which are the catchers for hormones there are on different tissues, how are those hormones being eliminated in the body. And we might want to be assessing them at different points before, during, and after treatment as relevant to the person, what they're going through. Might want to look at genomic stability. That's the stability of your DNA and also the regulation of your DNA by a process called methylation. And how do we repair our DNA? Because it can be really relevant in cancer, both in conventional treatment as well as anything else we might want to be considering in a broad setting. And I've bolded mental, emotional, spiritual health and circadian rhythms because this is central to how the person is going to cope with diagnosis, treatment, and either survivorship in the case of primary cancer, or living well with cancer when you have metastatic disease. So it's really important that this is embedded, that we do look after people's emotional well-being. And we don't just dismiss it, oh, well, everybody's going to feel rubbish during cancer treatment. We need to screen for trauma and PTSD, particularly in younger patients who might have received a new metastatic cancer diagnosis completely out of the blue. It is absolutely essential that we screen and then treat for trauma in those cases, and any other cases where trauma might turn up. We know certainly in gynecological cancers, there may be a trauma angle there in terms of, sexual trauma. So it is important that we address it and we don't just let it lie in the dark, because it affects people's emotional well-being and their HPA, or hypothalamic pituitary adrenal axis, which is also an important predictor of cancer progression and cancer mortality. And not forgetting that we're not just breaking people down in small boxes or different parts of the physiology. Everything is connected. You must always, always look up at the person and see the broad picture. There is training available. I mainly train nutrition and herbal medicine, integrative health professionals, and I cover the systems approach to cancer in a 6-month online introductory course, which is currently mainly for nutritional therapists, nutritionists, and dietitians. And there's also an advanced breast cancer course, which does require you to complete some kind of foundation training, which is suitable for a broad range of patients. It is quite in depth, so it's quite rigorous. I'll just give you a few examples from the clinic before I finish up and wrap up this session. And really it's just about thinking about what kind of support people might receive when they come to a clinic like ours. So, for example, we have people coming to us across the board, people who might have completed treatment and want some advice about recurrence risk management, trying to minimizing those risk factors. Might have people who are suffering from long-term effects of treatment. So we have people who might be having ongoing treatment-related fatigue, actually weeks and months, and we need to be able to support them and rehab them and allow them to return to some kind of normality. But also readjusting their expectations and also managing things like anxiety, for example, for people who are going to be returning for follow-ups going forward. We also, of course, always work with patients with active cancer during their treatment in terms of looking at the side effects. And again, phasing in and out through treatment. So quite a lot with metastatic cancer, people might have gone through treatment which leaves them quite debilitated. So, for example, we have a number of different cases, but one cancer case that jumps to mind is a metastatic colorectal cancer case where a lady came to us with, having bowel movements every 90 minutes. She couldn't sleep. She had to get up to go to the toilet. She was also incredibly debilitated and losing weight, and not really able to stabilize after a hospital admission for lung surgery, which was designed to remove some of the metastases from her colorectal cancer into the lung. Actually, no one's really talked to her about her gut and what was going on there. So addressing and treating her gut means that within 2 to 4 weeks, we actually had a normal gut movement, normal bowel movements at 1 or 2 a day, not loose, not urgent. She was able to sleep. We also worked on inflammation, for example, reducing her inflammatory markers to 1/8 of what they used to be in just 4 weeks. Enabled her to gain weight, enabled her to get going with exercise again, to be able to tolerate it really well, to be able to get out and have a normal social life. And with the ups and downs in treatment, we know again with patients who have a metastatic diagnosis, there will be good news and bad news on scans. Psycho-emotional well-being support is always a key part of what we offer as well. We might be offering people additional support during treatment breaks, for example, to enable them to really increase their resilience and prepare them for the next cycle, as well as taking really debilitating side effects. We've had patients with horrible diarrhea or nausea and vomiting, or starting to get peripheral neuropathy, who were much better managed in the integrative setting as we went along. This general summary just of what I've talked to you about is just remember that integrative oncology, where it's practiced well, is a rational and personalized approach based on the synthesis of evidence-informed, conventional, psychological, nutritional, lifestyle, and complementary medicine in cancer care, with the aim of supporting better quality of life, improving resilience, and minimizing the side effects of treatment, as well as improving clinical outcomes, whatever they might be. We know that appropriate use of evidence-informed lifestyle complementary intervention can be of significant benefit in relieving side effects and improving tolerance of treatment. And ideally, we'd want it to be a part of an integrative care plan so that everything is thought through and everything is pulling in the right direction for the patient, and everything is reviewed regularly as the needs shift, as medications shift, as different phases of treatment or recovery shift as well. And to me, true integration alignment in the components of the management plan, whether it's conventional medication or whether it is complementary approaches, it is really important to align them for safe and effective care. And we do need more consistent, high quality education for both conventional healthcare professionals and, of course, complementary integrative medicine professionals with effective and collaborative two-way communication. And this is where charities and BSIO, I think, hope will play a really crucial role in the years to come. Thank you very much for listening.